Program's Gender and Agriculture Systems Advisor, and I'm also the Vice President of Gender and Social Inclusion at ACDI VOCA. I'm delighted to be facilitating this session today, and please take a moment to introduce yourselves in the chat. We'd love to hear from you and where you are and what you're doing. We're very excited to have all of you with us today. I'm also delighted to introduce Dr. Marlene Elias. She is with us from the Alliance of Biodiversity International and CIAT, and she's the leader of the Alliance's module of the CGIAR gender platform. She's going to introduce our session today briefly, and then we'll have some speakers after she introduces our session.
Okay, thank you, Jennifer. And I'd like to reiterate your welcome to everyone. It's great to see you all here to discuss, as Jennifer said, what is such an important topic. We know that gender-based violence in all of its forms, whether psychological, physical, sexual, economic, suppresses the capacities of those who experience it to thrive and to lead fulfilling lives and reach their potential. And in fact, that it hinders the well-being and the development of entire families and communities and of food systems more generally. We also know that gender-based violence is widespread, including across food systems, where it has very negative effects, not only on people, but also on productivity and trade and so much more. But it's received quite little attention actually in agricultural research for development. And research teams and practitioners are often poorly equipped to mitigate and to respond to situations where gender-based violence surfaces in the course of their work in food systems. They're also often poorly equipped to recognize how the innovations that they introduce, so be it new technologies or new ways of practicing agriculture and natural resource management, can actually foster gender-based violence by changing power relations and challenging the status quo. And as our engagement with gender in agriculture aims to become even more transformative, so as we increasingly seek to challenge the root causes of unequal gender relations, we can create even more resistance and backlash that can put women and more vulnerable actors in food systems at risk. So as researchers and practitioners working in this field, we have a responsibility to ensure that we recognize and we know how to monitor, prevent, mitigate, and respond to gender-based violence. And that's why toolkits and capacity strengthening efforts like the ones we'll be hearing about today are so important to help us identify how and where gender-based violence occurs in agricultural programming, and to find entry points to prevent, mitigate, and address it through our projects and programs. So in addition, those of us who are here today as gender researchers, or those of us who work explicitly on gender equality in food systems, are really tasked with not only keeping the issue of gender-based violence in food systems high on the research agenda, but also with gathering evidence and developing approaches to address it. So the CGIAR Gender Impact Platform is very happy to be here to partner with organizations such as those represented by our colleagues here today to make that happen, to share learning and to amplify our efforts to address this critical issue. And I'll hand it back over to you, Jennifer, to get us started in doing that, but want to thank you all once again for being here, whether as presenters or participants, and being part of this critical initiative. Thank you.
Thank you so much, Marlene. Such important context for this discussion and why we're all here today. It's important as researchers and gender equality practitioners, as well as the entire landscape of people who are working in food security, agriculture, market systems development, to engage in these discussions and think about the ways that this is an important topic in the work that we're doing. So we're delighted to have you here and delighted to have these speakers share their learning so that we can engage in this conversation. Today, we're going to be hearing from Dr. Shalini Roy, from the IFPRI Institute, the International Food Policy Research Institute. Dr. Roy is going to share about the importance of addressing gender-based violence in agriculture and market systems development programs. And she's going to be sharing some very interesting research findings about addressing GBV during her remarks. We're also joined by Annette Namunane, from MarketShare Associates. She's a gender empowerment, youth, and social inclusion advisor in Uganda, and she's going to share some of her project's experiences in addressing gender-based violence with the USAID Feed the Future Uganda Inclusive Agriculture Markets IAM activity. So I'm first going to hand it over to Dr. Roy for her presentation.
Thank you so much. Thank you for the introduction and the invitation to present at this great event today. So as Jen said, I'm going to be speaking briefly about approaches to addressing GBV across various sectors that have been found effective in the research. Next slide, please. To start, just to give some context, I thought I'd give a few examples of how considering GBV is important within agriculture and market development systems projects. So I'll draw first on some qualitative work that IFPRI colleagues did across Mali, Nepal, Tanzania, and other countries while developing the ProWEA instrument. In that work, they found that common strategies aimed at empowering women through ag programming can actually fail if women participants simply avoid participating out of fear of violent repercussions at home. They specifically note that GBV reduces women's agency in agriculture, for example, preventing them from seeking control over assets. You see a quote from a woman in Mali saying there are cases that a husband sells goods belonging to his wife without asking for consent. She can't ask for any account, otherwise she faces the risk of being beaten. It prevents their participating in groups or their collective agency. In Nepal, they find some women quit groups due to their husband's objections, especially if they feel that membership is not valuable enough to risk this inter-household conflict or violence. And it prevents them building their self-worth, so their intrinsic agency. There's a quote from a woman in Tanzania saying, "You will be afraid of doing anything on your own just because it can result in beating." Next slide, please. So other evidence has shown that GBV impedes many areas to determine whether these types of projects succeed or are areas that are actually part of those programs' objectives. So these include GBV holding back progress in education, health, nutrition, adaptation to climate change, adoption of sustainable livelihoods. We also see in the evidence that fear of sexual harassment or sexual violence in public spaces can induce girls or women to choose lower quality educational outcomes, to limit their opportunities for safe, decent work, and to depress their labor market participation. Next slide, please. So the WHO has recently put together a new framework on GBV prevention, and they motivate it with a few stats. So first, 1 in 3 women worldwide experience physical or sexual violence by an intimate partner or sexual violence by any perpetrator, and that doesn't even include sexual harassment. Among gender-based violence, intimate partner violence is the most common form. 30% of women worldwide experience physical or sexual IPV, so I'll be focusing a bit on IPV today. And as mentioned, this has major costs. It's a violation of human rights. It's a public health problem, and it's an impediment to sustainable development. But the key focus of the WHO's Respect Women framework is that violence against women is preventable. Next slide, please. So the framework identifies 7 evidence-based strategies, each signified by a letter in respect. And these aren't meant to be seen as silos, rather addressing multiple strategies, if that can be done well, can make interventions more effective. So these are R for relationship skills strengthened, E for empowerment of women, S for services ensured, P for poverty reduced, E for environments made safe, C for child and adolescent abuse prevented, and T for transformed attitudes, beliefs, and norms. Next slide, please. So I'm going to focus today on the P for poverty reduced. That's my area of research and what I was primarily asked to discuss. But for context, I'll just briefly mention other CG research on several of these strategies. So under T for transformed attitudes, beliefs, and norms, one example is a project a CG colleague is part of called Unite for a Better Life. And this is a gender transformative intervention in Ethiopia in the context of the coffee ceremony, which many of you know is a traditional community-based discussion forum. And they tried delivering to men, to women, or to couples together. And what they found was that delivering to men was effective in reducing men's self-reported perpetration of sexual IPV, but delivering to women or couples actually did not reduce IPV. So it really shows the importance of engaging men. But these kinds of interventions, it's important to note, really need to be designed carefully for the context. Here they use the coffee ceremony and tailor the content really carefully to the norms in the context. Next slide, please. Another example in that T category is mass media interventions or edutainment, and as it's called. So some other CG colleagues have been studying a television series called C'est la vie in West Africa, which has episodes focused on GBV and other topics as part of its programming. This has been delivered through film clubs of adolescent girls and young women in rural Senegal. And what they found is that watching C'est la vie does increase knowledge, including around GBV. However, they found that attitudes and beliefs with their trial were unchanged. So these types of interventions are really appealing because once they're designed well, providing them sustainably at scale is much more straightforward, since it's just a matter of screening a program that's already produced and you don't need the same ongoing staffing and capacity. But it is really important to carefully refine the messaging and to get the right type of exposure to have attitude and norm change. Next slide, please. And I'll just mention some exploratory work under the E on environments made safe, done by some CG colleagues. So they did a case study in Malawi looking at the gender gap in profits among entrepreneurs. And they found that among entrepreneurs, women's perception of how frequently women like them were sexually harassed was explaining a large portion of the gender gap in profits. They're doing some new work exploring similar relationships between sexual harassment and economic productivity among women in agricultural value chains in Benin and Malawi. And the hope really is that better understanding these relationships will help motivate and inform programs to reduce sexual harassment in work environments. Next slide, please. Okay, so turning to the P for poverty reduced, the researcher really emphasizes that there's a two-way linkage between poverty and IPV. This is not to say that IPV occurs only due to poverty. We know IPV has complex multidimensional causes, including norms, institutions, many other things, and occurs across all socioeconomic statuses. And so reducing poverty alone will not eliminate IPV. But poverty does significantly increase many risk factors for IPV, and thus reducing poverty can reduce the risk of IPV. So specifically, the framework here at the bottom shows that poverty reduces social status, it increases stress, it increases ill health, it lowers educational attainment, all of which are risk factors for IPV. IPV, in turn, reduces productivity and engagement. It increases out-of-pocket costs to women in the household, including due to health issues. It reduces social capital and capabilities. It adversely affects mental, physical, and reproductive health, all of which in turn contribute to greater poverty. So this cycle means each makes the other worse, but also addressing one can help address the other. So interventions to reduce poverty can actually be cost-effective in addressing violence, even when violence prevention is not an explicit focus. And it makes compelling the idea of leveraging large-scale social safety nets, such as cash transfers for IPV prevention, which really opens up large opportunities for scale. Next slide, please. So I'm going to focus on cash transfers because the evidence here is really strong. And because cash transfers already exist at large scale and their coverage has been expanding, particularly after COVID. So these programs also have a robust group of stakeholders because they're really effective and cost-effective in reducing poverty. And they already reach a large share of poor populations in many low and middle income countries, with this number expanding. In 2018, about 11% of the total population in low and middle income countries was covered, mostly vulnerable people by various criteria, meaning their recipients can overlap with people participating in ag and MSD projects. And so cash transfers are plausibly kind of co-located with these projects in many cases and can be a useful platform to leverage for addressing GBV. Next slide, please. So as I said, one of the reasons for the focus on cash transfers is that there has been a lot of evidence on their impacts on IPV. And what is that evidence? How do cash transfers affect IPV? So a recent review of 22 quantitative and qualitative studies found that more than 70% of these studies showed decreases in IPV from cash transfers, and the rest largely showed no significant impacts. So interestingly, there was no evidence of average increases in IP from cash transfers. A more recent meta-analysis of just the quantitative impacts of cash on IPV confirmed that on average, there were decreases in IPV. So this is interesting because there's often fears that cash transfers will increase IPV, particularly if they target women due to male backlash or men trying to take over the cash. And that concern actually motivated a lot of this research. But in fact, the evidence shows the opposite by and large. Cash transfers tend to reduce IPV, or in some cases not affected. Next slide, please. So why is that? Why do cash transfers affect IPV in these ways? There are three main pathways supported by the quantitative and qualitative evidence in the mixed method review I described, and I'll go through them one by one. Next slide, please. So the first comes out in a lot of this literature. It's a really common response in the qualitative work. And it's the idea that cash transfers simply improve economic security, which is their primary objective. But this then improves emotional well-being of household members, including reducing poverty-related stress. And this stress is a major trigger of IPV in poor households. So you see in this quote from Ecuador, a woman says, in my household, after they got the cash, it was like happiness. We all got along. In my house, we were happy because before we just did not have enough money for those things. Next slide, please. The second is related, but is specifically about conflicts that are triggered by tight budgets. So also in many qualitative studies, you see women saying that before, when they wanted to buy something, they had to ask their husbands. And if their husbands didn't have enough money, they'd start to argue. This would escalate to violence. And the cash transfers made it so that their husbands had the money, or women themselves controlled the money they needed to do what they purchased. And this avoided many conflicts. This is a quote from Turkey where a woman says exactly this: children needed many things that we couldn't afford. I asked my husband, he used to say there's no money. I used to get upset and start to yell. She says, we had many fights because of poverty, not only for us, for all poor. Fights come from suffering. Next slide, please. And the third pathway is women's empowerment. And this is particularly if the transfers go to women and stay in their control. Essentially, this gives women more power in their relationship. In some contexts, it might make it more credible that they could leave the relationship. And essentially, it gives them more strength to assert that they will not accept violence in their relationship. So you can see in the quote from Uganda, a woman is saying that her husband would, sell household items without consulting her, but now that she has her own money, she has a say in how to spend income. She can buy seedlings, she can hire a plow, and so on. So it's worth noting here that the framework also allows a possibility that a woman's partner could react negatively to her empowerment, and that ICP could increase due to backlash. Again, interestingly, this is something we actually don't see often in the quant or qual evidence. But design decisions should nonetheless be intentional in trying to safeguard against this possibility. So aiming to minimize any risk by proactively engaging other household members and framing the transfers appropriately. Next slide, please. So just to give an example of the evidence, I'm going to give a quick overview of a case study from Bangladesh. This was on a program called the Transfer Modality Research Initiative, or TMRI. It was a randomized control trial implemented in rural Bangladesh. And this particular study focused on whether reductions in IPV from cash were sustained after the program ended, and whether this depended on complementary programming that was provided alongside the cash. It's common in cash transfer programs for there to be other kind of complementary programs alongside. So TMRI was a pilot program. It was implemented by the World Food Program from 2012 to 14. It was targeted to mothers of children under 2 in very poor rural households, and it provided cash transfers or food, but I won't discuss that portion today, with or without this complementary intensive nutrition training. There were 3 components, the most intensive of which was weekly group meetings with about 10 target women in each village, along with a well-trained community nutrition worker and interactive sessions. Some of these sessions also invited husbands and mothers-in-law who are influential household members in this context. There were also biweekly home visits where the nutrition worker counseled the family on nutrition. And there were also community meetings monthly to share the same nutrition messages with community leaders. So to note, there was no explicit focus in the training on gender or violence, but it did have a gender-sensitive design. So the study context of rural Bangladesh at the time was quite patriarchal, with female seclusion norms, meaning target women rarely left the home without male accompaniment, and they tended to be quite isolated. So in the design, inviting other household members to some of these nutrition group meetings actually served multiple purposes. It gave those household members the same nutrition messages, so helped with uptake of that, but it also helped husbands and mothers-in-law see the trainings, see that they were good, see that they were non-threatening, since child nutrition is a topic that's in mother's traditional domain, and agree to let women attend. And so engaging these other household members actually made it more acceptable for women to attend. Similar for the community meetings, which highlighted the importance of these topics. These gave community support to the actual nutrition practices, but also made it more acceptable for women to be traveling regularly to these sessions. Now, an interesting thing that happened was how women's social interactions and empowerment changed through these trainings, despite their focus really being on nutrition. Most directly, they went from being quite isolated to meeting peers once a week. Anecdotally, women were coming early, staying late. These were like lively, high quality sessions, and they made friends through them. On top of that, the community was valuing what women were learning. Our evidence actually shows that neighbors of the training participants were coming over to their homes to now learn what they should do for their children. So the participant women went from being seen almost as beggars to be respected community members who were experts on a valued topic. So we think this expanded their social capital in important ways. Next slide, please. So what do we find in terms of IPV impacts? During the program, our evidence suggests that cash alone or cash with training did reduce IPV. That's consistent with the prior literature. But then we went back 4 years after the program ended, and we found the cash only group now looked much like a control group that had never received any intervention, whereas the cash plus training group was still experiencing significantly less physical IPV than either of those groups, 42% less in fact. So essentially adding this nutrition training to cash helped sustain the IPV reductions. So why was this when the training wasn't about IPV? We think it had to do in part with the social capital, since those relationships may have been sustained after the program ended. In terms of the evidence on the pathways, we see sustained impacts on women's empowerment, economic, psychological, and social. Again, we think partly from the social capital. We see evidence indicating that this increased men's costs from perpetrating IPV, in the sense that women were now more visible in their communities, and this meant any violence perpetrated against them was more visible and brought more social disapproval. And we even see that economic security was still higher in this group 4 years later. I won't get into the details, but in part, we think this had to do with livelihoods that women took up due to the combination of having resources from cash and the knowledge and agency from the nutrition training, including now raising livestock and poultry and doing more homestead gardening. Next slide, please. So to wrap up, there's strong evidence suggesting that cash transfers are proven interventions to reduce IPV at scale, even when IPV is not an explicit focus. Adding gender transformative approaches to cash transfer programs can be done as part of these complementary programs and could be promising, but it's important to note that that type of programming should only be added if it's carefully designed for the context, piloted with local IPV experts, and implemented by well-trained staff. So these gender transformative approaches should not be tried by people who are social protection experts, but not familiar with the gender context. That said, many large-scale government cash transfer programs don't have this kind of expertise and capacity, but there are many light touch design decisions that can be made to try to promote IPV reduction and mitigate risks within just standard cash transfer programs. So a colleague and I recently wrote a brief with many recommendations on these. So for example, to strengthen women's empowerment while mitigating risks, design choices could include targeting women, but really carefully designing the messaging and framing and engagement of other household members to try strengthening her control over this transfer while minimizing risks. As the Bangladesh case study showed, complementary programs can help strengthen and sustain these impacts, but the choice of the program might depend on the context. So in Bangladesh, the way the group training empowered women seems like it was really tied to the norms there. We do note that where there are high quality services for GBV survivors, linking a cash transfer program to those services can help respond to GBV when it's observed, even though my focus here has been on prevention. And some of these lessons from cash transfers might inform approaches for making other types of interventions responsive to GBV. But in all cases, it's important to note that monitoring and collecting data on the specific program are critical to understanding what's really happening in that specific case. And I think this might relate to what the next speaker will discuss too, so I'll stop there. Thank you so much.
Thank you so much for that wonderful presentation. There's a lot of fantastic information, and I'm sure people have questions. So if you do have questions, please feel free to post them in the chat. We'll be holding a Q&A session at the end of our next speaker's remarks. So please do feel free to keep them coming as our speakers continue. I'm going to turn it over to Annet, who is going to talk about her experiences with the IAM activity. Annet, please take it away.
Thank you, Jen. Good morning, good afternoon to everybody that is on the call. I'm going to speak about our experience in addressing GBV at project level, but more focus is going to be on our experience and the lessons learned and the recommendations from the toolkit that was developed by Feed the Future Advancing Women Empowerment activity. So I'll start with an introduction of what Feed the Future Inclusive Agriculture Markets is. This is a 5-year activity that is implemented by DAI Global, together with MarketShare Associates and TechnoServe. The activity seeks to increase incomes and improve livelihoods of households through agriculture-led economic growth using the MSD, the Market Systems Development Approach. In all this, inclusion is at the heart of Feed the Future IAM interventions. As such, the activity seeks to empower women by facilitating investment in inclusive business models that intentionally seek to increase women's leadership in business, improve workplace equity, engage more women in supply chains, and target them as customers to the agri-inputs and services needed to increase productivity and improve households' livelihoods. And this is the reason as to why we find GBV response as very key, because GBV is a key constraint in limiting the achievement of our goals. So we prioritize the response as an activity. So why are we talking about FTFIM and why are we talking about FTFO? Like I mentioned, the activity was selected to pilot the GBV in agriculture and MSD toolkit, and it was selected because of several reasons. For example, according to the 2016 US strategy to prevent and respond to GBV globally, Uganda is a USAID priority country in which to address GBV. So also I am, as an activity, is cognizant that for meaningful participation of all in market systems, it's imperative to address constraints like GBV that limit women's and other marginalized participation in the market systems. So the activity also believes that even when GBV is a social problem, agriculture and MSD, which are private sector majorly, has a part to play in the solution, because, as my colleagues earlier put it, there is a high cost to the vice as it limits productivity, increases absenteeism, and also raises high costs of healthcare in case any survivor or victim is affected. So the activity also has an existing commitment to mitigate, respond, and prevent GBV in market systems. So this toolkit came in actually timely to guide the process, and therefore there was no need to reinvent the wheel. In fact, the activity had already planned an assessment which would inform its activities, and this coincided with the pilot period. Next slide, please. So I'm just going to give a brief background about Feed the Future Advancing Women Empowerment. The work we are sharing with you today is part of the Feed the Future Advancing Women's Empowerment Program, and in short, it's L for Advancing Women Empowerment. So it's a USAID funded project, which is 5-year, that supports USAID's Bureau for Resilience and Food Security through conducting research, developing tools, and providing technical assistance. Our work on L is designed to help staff from USAID bureaus, country missions, and implementers scale up activities, understand best practices, and conduct analysis to ultimately increase empowerment of women working in agriculture and market systems. Next slide, please. So as Jenn earlier mentioned in the intro, this toolkit intends to provide practical guidance for agriculture and MSD technical staff and gender and social inclusion advisors. It specifically focuses on GBV in the day-to-day programming, and as such, the purpose of this toolkit is majorly to make it easier to identify how and where GBV shows up within the context of agriculture and MSD programming, but secondly, support project staff to think through logical entry points to integrate GBV prevention, mitigation, and response in the ongoing activities. So it can be used as a toolkit that can plan for unexclusive GBV response interventions, but also it helps to integrate in the already existing activities or interventions that the program may already be running. So whether you are at the beginning of your interventions or you're halfway the journey, this toolkit is very user-friendly for whatever case or whatever level of project implementation that you are at. Next slide, please. So I'm now going to speak majorly about the piloting the GBV in agriculture toolkit. So our experience, Feed the Future, I reached out to FTFIM about the activity being a perfect fit for the pilot. Of course, to us, this was an opportunity in which we welcomed, because it fit in very well with the interventions. We are an ag-led economic growth activity, but also we are using the MSD approach, which the toolkit really fits well with our interventions. So following this, the pilot testing started in May 2021 and ran through to January 2022. The activity, with facilitation from the team of Feed the Future Advancing Women Empowerment and the Feed the Future Inclusive Agriculture Markets team, held 2 trainings for staff. The first was an introduction to the toolkit, and there, about 3 months later, we held a deep dive. So refreshers have been held, especially during the work planning processes for staff, but also as new hires on the team are onboarded as part of their orientation process. So the activity has engaged over 20 staff, both technical and operations, in the pilot process. These staff have been engaged in the mapping GBV in the different value chains, as well as prioritizing GBV constants in the interventions. so far over 50 hours over a period of 9 months. That is quantifying across the different, not that the 50 hours were, let's say, a week and a half or so. No, this, if we quantify the different engagements we've had from the time we interface with our first interface with the toolkit up to now, it's been up to the end of the pilot. It was about 50 hours over a period of 9 months. And these have been devoted to coaching, mentorship of staff, also other USAID implementing activities, and as well as the private sector that we engage as part of our interventions. So in this, the activity has held sessions with the agri-input and grain trade companies on a compelling business case for addressing GBV beyond the moral and ethical case. I think when we talk about GBV, we know that there is a moral and ethical case for addressing GBV, but sometimes this may not get a quick buy-in, especially when you're speaking to the private sector, which we majorly work through. So for us, we try to bring a compelling business case to show them that, look, here is a risk you'll face. These are the losses you'll incur in the event that you do not address GBV at your workplace, in your supply chain, among your agents, and amongst the farmers at primary production. So we try to quantify some of the losses that they may incur as they address issues of GBV. So once you do this, the private sector actually gets a quick buy-in, because now they see that it affects them and it affects their profitability as a business or as an entity. So the pilot period, the activity has continued with rolling out of post the pilot period. The activity has continued rolling out the toolkit to the USAID IPs, mainly USAID Integrated Agriculture and Nutrition activity. It's also a Feed the Future activity, and also there's another Feed the Future activity called Institutional System Strengthening, that is majorly looking at the governance bodies within the agricultural systems in Uganda, and has held introductory sessions with some of the staff from these activities. Next slide, please. So now we will be delving into the gist of the matter, and that's the lessons learned during the pilot process. So for us, we as an activity, and together with the Feed the Future, we came up with a learning brief that has 8 lessons and recommendations that have emerged from the piloting process. And for this particular presentation, I'm going to focus on all the 8, but I will try as much as possible to be brief, because we don't have so much time before we get into the question and answer. So the first lesson was more than half of the participants had never used the toolkit or any related resources to address GBV in their work before. Although they had witnessed GBV in their work, or some of them had addressed it knowingly or unknowingly. So after using this toolkit, they felt they could easily refer to the tool and now have a better understanding of the different forms of GBV. Some of them would not actually tell the difference between GBV and domestic violence. But as we speak now, they can categorically differentiate between the two, and where they occur in the different value chain nodes, and how to respond as MSD practitioners. So for us as an activity, Feed the Future Inclusive Agriculture Markets, we don't look at any specific value chains. We are not value chain specific. So, but the people the staff that we trained are able to now tell, irrespective of the value chains, they are able to tell at whatever value chain node that there could be high levels of GBV or the risks therein. So this also guides how we develop the mitigation plan across all interventions that we design, to ensure that we do not have unintended consequences of GBV. So some of the annexes in the documents that we found very useful, we have the GBV risks. One of them is the GBV risks for agriculture and MSD projects by value chain node. This one is basically a menu that looks at IPV and sexual exploitation, abuse, and harassment in the different value chains. So we use this actually in one of our annual plans, where we were able to brainstorm and come up with the different risks that we may have across the intervention areas that we have as an activity. And this is Annex 1. Then the other annex is entry points to integrating GBV response measures across agriculture and MSD project life cycle. So during the process, we used pathway 1 of the annex, where we focused integration of GBV in the project cycle. This was during last year's work planning process as well. We, however, saw that pathway 2 was a bit more comprehensive for us as an activity that was highly inclusive. So here we conducted a fully fledged GBV assessment across the different intervention areas and across different selected value chain nodes. Different value chains that we focus on. So as well, then this has informed the implementation, evaluation, and also is going to inform the behavior change and communication campaigns that we have of the GBV risks that exist within the market systems. So, and this as well is going to inform how we develop a business case in addressing GBV at project level, but at partner level. Like I mentioned earlier, for us, for the private sector resonates well when you speak about a business case on addressing GBV in their work. So for us, we will come up with a business case for the different partners that we target. Then we also have Annex 5, which is a worksheet that prioritizes GBV concerns in project life, and Annex 6, which was prioritizing potential actions a project can take to address GBV. This looks at the root causes, the entry points, and the potential actions. So if you have an activity, you list it on the worksheet, and you'll be able to brainstorm the root causes of why there's GBV and the entry points of how we can address it and the potential actions that can be done to ensure that there is no GBV as you conduct your interventions. Next slide, please. So lesson 2, here we looked at the practical uptake, takes time and resources. For example, inspired by the toolkit, 10 Feed the Future I Am members were selected as GBV champions, and these dedicate 10 to 15% of their level of effort to ensure that they use the toolkit to address GBV issues in their activity. That's at partner and cross-partner level. This is roughly an equivalent of a full-time staff per year for the effort of this staff. So here, majorly, we are looking at practical uptake of GBV in Ag and in MSD. It really requires substantial time and training beyond the initial orientation and dissemination of documents. We don't want to end at dissemination and shelving these important resources, but we want to go beyond that and intentionally use the resources. But the JC or the GBV specialist may not be the only person that can push the cause. It has to be a collective effort for all team members to come on. So for us, we saw that having a dedicated team that has time, level of effort dedicated to this would be the most ideal to achieve our objective. And I can assure you it's really working very well. Then the champions are also staff who are passionate about GBV response and are from different functions of the activity. These ensure that there is an integrated approach to tackling GBV in the agricultural market systems, as well as enabling shared learnings through experience within the team. They are both technical and operational staff. So we, as an activity, we have 5 offices across the country, and each has a minimum of 1 champion. So at least we know that there are some offices that have more than 3 champions, but at least every office has a minimum of 1 champion to push for the cause. And then to date, it has taken us about an hour monthly to coach the champions on different sections of the toolkit, and an hour quarterly to coach the partners. We also use this platform to share learnings from the field engagements. Of course, when we go to the field to interact with the farmers, with the agents, with the private sector, there are learnings that we see. We also get to know of some risks that some of our activities may cause. And so we come back on a monthly basis as champions to discuss a way forward on how these can be addressed. Then we also have a functional WhatsApp group that keeps all champions up to date with the GBV in MSD space. So on a daily basis, we share information, we share resources, we share about webinars that may impact the work that we do or that may increase the knowledge levels around GBV. Then also there was a very high buy-in from leadership. So rather than seeing this as an additional work for the staff that were self-selected as champions, we saw the high project leadership saw an opportunity in this. First, their quick acceptance of the toolkit as a means to achieving meaningful growth, and also willingness to commit time, resources, and to see that we address GBV in the work that we do. Next slide, please. So lesson 3 is training sessions are key. So beyond the deep dive sessions on the GBV toolkit or the introductory sessions, it's important that we consider more time to digest the different sections of this toolkit, and also to ensure that this toolkit, it's user friendly, and the more you interact with it, the more you see how it makes your work easy. Rather than brainstorming without prior information, the toolkit is one-stop center that has all this information. So as an activity, we invested in a good amount of time of training staff and partner staff. These trainings have aimed at increasing consideration of using the toolkit after conducting the initial training through the deep dive and the introductory sessions. And for us as Feed the Future we have 3 technical areas, which are input distribution and agribusiness services, transactional advisory services, transactional advisory and financial services, and also value addition and quality food trade. But amongst these, there is uniqueness in responding to GBV across these different intervention areas. So this has allowed us an extended time period for staff to better consider and digest information and have the easiest way to understand how best they can use the toolkit. And after gaining a greater familiarity with the toolkit and user guide, the IAM leadership and technical staff reported that the GBV in agriculture the toolkit is a practical, comprehensive, and likely to become a go-to resource. And we are already going to it. As I speak now, there is a team of staff in the field that are training the private partners on how to use the different resources, on how to respond as guided by some of the very well put together resources in that toolkit. So this has also, it creates, it's cost saving, because now for us as an activity, we did not get into hiring a consultant to retrain us or to develop resources, but we were able to use this toolkit based on the trainings that we invested from the beginning until now in the toolkit. Next slide, please. And also we see there is an opportunity in having an institutionalized response. Allowing staff to collectively address GBV has encouraged and supported technical staff to reference GBV in agriculture toolkit as well in their work and in everything beyond their work. So agriculture technical staff may not clearly understand by default the relevance of mainstreaming GBV lens in agriculture and MSD activities and the associated resource constraints. So recognizing this challenge, it is very important to have a buy-in from senior leadership. So this can give an institutionalized response to allow staff to collectively address GBV in their work. So like I earlier mentioned, the chief of party and the deputy chief of party of our activity formed a code. With their support, we formed a dedicated group of champions. And with a clear mandate within their contracts, there is time level of effort, like I mentioned, of 10 to 15%. So this was from the higher level. So if the higher level has got a buy-in and has allowed to institutionalize GBV, it becomes very easy. And now we don't only look at GBV at the point of interventions or within the interventions that we do, but we look at GBV also at our workplace. Once there is a high buy-in, then there is an understanding of how we deal with GBV at our own workplace, within the partnerships and stakeholders that we engage, and also within the interventions that we do. And also I'll give an example of there is need for resources to address GBV, and still the senior leadership has gone ahead to allocate resources within the work plan and within the budgets to ensure that we design interventions that are tailor-made for GBV response mitigation within the works of our activities. So another example is a case study. We work with an area cooperative enterprise which has staff that have volunteered as champions, as well as farmer groups champions that will continuously create awareness in referencing the toolkit. And this we did not do without the leadership of the area cooperative that we work with. So it's very important to have an institutionalized response where we have a guiding principles on how this can be done to ensure that the work of our interventions are sustained even way beyond some of the project life of any activity for USAID or any other funder. Next slide, please. So lesson 5, we look at the GBV in Agriculture Toolkit guidance and tools have been practically applied and may serve as a use case for future toolkit users. IAM staff have used the toolkit and annexes to inform their work on GBV across the different intervention areas. Key to this, it has been the technical and practical aspect of the toolkit that once we used it comprehensively, we've learned along the way that GBV in market systems can be understood by anybody. This includes the definitions, the types, and where it occurs. So the technical sections helps the team to plan GBV activities in their annual work plans and has informed GBV assessments in the different value chain nodes, as well as informing the works that can be done for behavior change communications. If we look at the different intervention areas, every intervention has a unique risk, and the intervention areas have to be contextual to that unique intervention. So the toolkit has been an invaluable resource that IAM has used to develop GBV mitigation and response plans, and it's also planning to use it for developing policies and mitigation plans for the partners, as well as the toolkit will also guide the mail processes to monitor GBV responses in ag and MSD spaces. IAM has also adapted to prevent, mitigate, and respond section as a key pathway and to guide in integrating GBV into the different program streams of work with their partners. The annexes have been particularly useful for our work with the partners and have introduced the different usefulness, the different ways we can use the toolkit. Okay. So lesson 6, we look at incorporating GBV tools into operational practices to foster greater learning and participation. Here we are looking at areas around work planning and assessments that help to foster learning within the partner and also at the project level. I am running out of time, so I'm going to the next lesson learned, and that is lesson 7. Next slide, please. So adaptation enhances relevance. No, the slide before, yes, that one. The adaptation also enhances relevance. The toolkit may not be relevant to the different structures of ag or market systems. For example, if we're working with farmer groups, there needs to be an easier way of any champion at that level that can be able to interpret the user friendliness of the toolkit. So we are also looking towards working to translate some of the resources like the survivor pocket guide, which is a good user-friendly tool for people at grassroots level that are interfacing with survivors and victims. Next slide, please. And the final lesson learned is through referrals, users have prompted wider awareness of GBV in Agriculture Toolkit as well as other relevant resources. So a case study here, we are looking at Oasis Agribusiness used the toolkit to conduct awareness creation sessions for GBV and report cases, and have used the pocket guide in their field, and also in identifying and being able to structure how they refer the victim for help. So it has also guided them in coming up with a referral pathway of how they can be able to get help, whether health or counseling or police. They are able to tell where to run, but this has been through the different referral lists that also exist within the toolkit. But also, we have referred the toolkit to other activities, like I earlier mentioned, the two USAID funded Feed the Future activities have been able to also use this toolkit in their work. And one of them is actually planning a training, and they'll be using the resources from the toolkit to train their staff and their champions. Next slide, please. So there are some user recommendations that I may not run through, but they'll be projected here. So one of them is providing facilitation guidance to connect how addressing GBV outcomes is integral to the project theory of change or results framework. We found that Annex 2 was very helpful in this, especially in identifying the entry points for integrating GBV response. This has also helped us with some of the unintended consequences of activities that may lead to GBV. So these resources will be shared, and I've run out of time. Thank you so much. We'll be going into the next session. Thanks so much.
Thank you so much, Annette. There are so many lessons learned from this pilot, and I know you have a lot to share. The PowerPoint slides will be shared along with the recording of this session, and I know people do have questions. So please do post them in the chat if you have questions. I do see one question has come in, and Michelle, we're going to ask your question, but if you do have clarification on the question, feel free to add additional thoughts in the chat or come off mute. I'm actually going to direct the question to Annette first. The question is, Michelle is asking about how to measure impact, especially the economic impact at the private sector level. Now, I know IAM is working with the private sector on making the business case for addressing gender-based violence. Annette, are there ways that you can provide experience or perspective on how IAM is working with the private sector to measure impact?
Thank you so much for that question. I think, I appreciate the question, and for FTF-IAM, we know that it's very imperative for the private sector to have quantifiable figures on how GBV is affecting them and how this costs them in terms of business, in terms of profitability, and in terms of the time. So sometimes we have used some of the records in terms of profitability for a period of time. If they have had any cases of GBV at a workplace, how are their volumes of production looking like? So if we look at the volume of production for, let's say, a period of 1 month where you had women experiencing IPV at household level, so that also rings a bell to the private sector to know that if we have about 5 farmers that are experiencing GBV at household level, then this is costing us in terms of the volumes of production, and also it's also affecting our supply chain. But also, we also look at the level of performance of staff. If it's at a private sector level, and what is the level of performance of staff? And if there's a staff that is experiencing GBV at workplace or back at home, their level of performance will not be at its best. So that also helps us know that there is a challenge and this has to be addressed. But more directly, we are working towards having tools on how we can measure this. But right now we are using proxy existence measures to know how it's impacting. Thank you.
Thank you, Annette. Shalini, did you have some thoughts on the question as well?
Sorry, it took me a second to unmute. Yeah, so I agree with everything Annette is saying. I think there's also attempts to now generate more direct evidence. As I mentioned, some colleagues of mine are working on looking specifically at how GBV relates to economic productivity and gaps in profits and market systems. There's also a lot of evidence that shows more generally the costs of GBV in terms of a lot of outcomes that we know closely relate to profitability, including education, health, capacity, agency. So I think the evidence that's there is already quite compelling. I think the new evidence will hopefully speak more directly to outcomes like profits and productivity. Thanks.
Great. Thank you for that. Are there, I was going to ask the audience if you have additional questions. Again, please feel free to post them in the chat. I was going to ask as well while we're thinking about this. I think the question about the private sector engagement is a really important one as we think about, there's some really great evidence around agriculture and the different ways that gender-based violence shows up in agriculture. And I think, one of the things we've touched on lightly is engaging the private sector, excuse me. But I wanted to also raise the question about how are you working through some of the existing structures, or what are the benefits of also identifying and working through the existing structures in the context where you might be implementing a program, but also needing to leverage what is there. And so I think sometimes we look at our programs and realize I can't do it all. So starting with you, Annette, how have you handled sort of understanding the landscape of resources or structures? And then I'll turn it over to you, Shalini, maybe to comment on that as well.
Okay, thanks so much, Dr. Jenn. I think for the private sector, like you rightly put it, they do not have the resources and the time. And most of them actually do not yet have dedicated staff as contact safeguarding persons at workplaces. That is something we are trying to work towards, having them adopt and dedicated staff at their level. But like you said, we can't do it all. And sometimes we don't respond because we are not aware of the services that exist within our proximity. So what the private sector is doing is doing a mapping of the service points using, like I mentioned in the presentation, there are referral lists that guide on how best you can map out the service points of the different services depending on the type of GBV that any victim has experienced. So once they do this mapping of service points, they develop a referral directory that they use. That referral directory has the different contact persons. Say if it's health, if it's nearby health facility, have a contact person of somebody they can go to. If it's a civil society organization that exists and is providing psychosocial support within their context, then they're able to reach out to that civil society organization. And if it is a legal service provider that is within their proximity, then they're also able to reach out to that. So for them, the most important thing is having a contact person at their office that can be able to register all these cases. As FTFIM, we have adopted the national GBV reporting tool. Uganda has a national GBV reporting tool, incident reporting tool. So that reporting tool, you submit it to the district that has a community-based services department to report to the national level, but also you remain with a copy and you're able to know which services are needed and where can we send this particular person for help. And also there is follow-up within that tool. So that also we've used this opportunity as FTFIM to make sure that the private sector also adapts this national reporting tool and they're able to refer cases and follow up these cases. Thank you so much.
Thank you. Shalini, any thoughts on from your perspective?
Sure. So I would just add that I think it's really important and useful to, in any program, work with local women's groups and those who are really experts on the context and know not just what services there are, but which are actually good. You know, I think referring women to services is really key when those services are high quality and supportive, but referring women to bad services can be dangerous for women, right? That it's not costless for them to seek those out. And if they don't get proper support, it can actually put them at risk. At the same time, within projects and programs, there can be things, I completely agree that programs should not try to do it all because simply these are sensitive areas and we should not kind of overreach into things that might lead to backlash. I think there can be thought kind of analogous to the way the cash transfer programs can be kind of tweaked in terms of design to try to bring in features that may be more empowering, that may mitigate risk of backlash. I think there can be a lot of thought put into what's already being done by this program or others that could be tweaked to have stronger effects on what you hope for. And if that's GBV prevention or response, that may just be, you know, for example, bringing women together in groups or kind of creating more household support for her role and being more proactive and engaging other household members, including men. Thanks.
Great, thank you. Thank you for those remarks. And you brought up some really fantastic and interesting insights. I'm really looking forward to diving more deeply into your research around IPV and cash transfers. So I thought we could ask a final question around thinking about cash transfers and the reduction of IPV. Is it required for women to be the transfer recipient? What if cash transfers were going to men? Would we expect to see very different results, or what are you seeing in the evidence around cash transfers there?
Yeah, thanks for that question. So it's interesting because some of the pathways for cash transfers to affect IPV don't directly rely on the woman being the recipient of the cash transfer. So reductions in poverty, reducing stress in the household play out even when men get the transfers. We did a study in Mali, specifically on a transfer that was going primarily to men, and we still see reductions in IPV coming through these pathways of reduced poverty and reduced conflict. What we don't see is empowerment of women. One of the rare studies that actually randomized whether the transfer went to men versus women found that you saw reductions in IPV from both, but that the effects were stronger and broader when they went to women, likely because her control over the transfer led to her being empowered and gave her kind of stronger influence over some of the risk factors for IPV. So I think the short answer is both can reduce IPV, but targeting women with appropriate mitigation of risk seems like a much better approach for targeting IPV. Thanks.
Thank you. That's a great insight and a really important distinction. So thank you for that. Well, with that, I'm going to bring this session to a close. I think we do have an additional question that showed up in the chat that we'll seek to follow up, I think, separately. But we do have a slide. We have contact information. If you would like to ask further questions about the Advancing Women's Empowerment Project or the Uganda IAM activity, please reach out to us directly. And if you would like more information about CGIAR or the research that Dr. Roy has shared, please feel free to reach out directly to the people on the screen. Before you go, we would love if you could take a moment to just respond to a final question. We have a fun Padlet activity. The link is in the chat. We'd love to ask if you could share what else you'd like to learn about this topic, so that we can bring more opportunities to share and discuss with you. So feel free to click on the link and share your thoughts. We will be, again, sharing this recording and the PowerPoint, and we did share resources in the chat. There will be those opportunities to read those resources and share those resources too. But thank you again for joining us. We hope you found this information interesting and useful, and we'll continue to have more discussions on this topic in the future. Thank you to our speakers, and thank you to CGIAR and Feed the Future All program and USAID. This was a really exciting event. Thank you all.